one, and good morning, everyone. This is Dr. Joff. So, today we are going to talk about the foods for arthritis. And let's turn my camera around. Hi, everyone po. Good morning. This is Dr. Joff, and I am back in the clinic po. And if you know someone with arthritis or with knee pain, with hip arthritis, please see me at the Cebu Orthopedic Institute. Again, this is Dr. Jonathan Flordelis, and today we are going to do a group coaching / consultation on arthritis foods. What foods do you need to know about that can cause or worsen your arthritis? Other patients think that only uric acid arthritis or gouty arthritis yung may foods na kailangan i-avoid, no? Pero actually, there are such a thing as pro-inflammatory foods. Ano ba yung pro-inflammatory foods? What foods can worsen your joint pain? This is what we are going to talk about today. So if you are interested or if you have someone in your family, friends na may arthritis who is interested in this, please share this video po before we continue. I'm just going to slowly set up po my video and my laptop. If you are hearing me loud and clear po, please comment below. Gusto ko malaman po if you can actually hear me, if you guys are actually listening. Really nice to know na may nakikinig. Also, if you are not following Dr. Joff Hip and Knee Arthritis on Facebook, I'm also on TikTok and on Instagram po. Now, if you know me, you know that I talk about not just osteoarthritis, I also talk about yung rheumatoid arthritis, gouty arthritis. You also hear me talking about injury versus arthritis kasi a lot of the patients I have think that they have arthritis, think that it is something to do with food when actually meron po silang injury. Pwede kasi na may injury that they think it's arthritis. A slight twist in the knee after Zumba, a slight misstep po sa stairs, pwedeng mag-cause ng injury sa medyo may edad na po. So thank you, Tessie Marty. Glad to know that you are hearing me. She says she's following me now. And I really appreciate those who are following. Also, I'm going to share this video in the groups po. So if you are not part of the Facebook groups, we have a Hip and Knee Arthritis Philippines Facebook group, and we will be posting this video there as well. So we have, if you have any questions about arthritis, feel free to ask these questions po. Kasi po, this is also a free consultation. Again, this is not just me talking. I'd like to hear from you din po. If you have any questions, if you have any comments, would like to know about them as well. Kasi I know maraming misconceptions about arthritis. Marami ding false information out there na ito pa yung supplement na nakakawala ng arthritis. Let me just turn my electric fan kasi sira yung aircon ng office ngayon. So, yeah. For those who are following me, again, please share this video with people who you think need to know about foods for arthritis. Food is really the cause of a lot of problems po, ano? Food can be the cause of a disease, and it's not just arthritis, it's also sa heart disease, it's also diabetes, and that's why food is really, really very important. Sa health and fitness po, I am not perfect myself. Ibig sabihin, I also have times where I eat those yung really pro-inflammatory foods. Yung foods na makakasira sa joints are also foods that injure some of our guts, no? So pro-inflammatory foods can cause yung pamamaga or inflammation inside the body. Yung first part kung saan magkakaroon ng inflammation, pamamaga, and damage is actually yung tiyan, yung gut po, yung mga intestines. The moment we absorb these pro-inflammatory foods, which usually contain a lot of sugar, this is something that damages the gut. You will feel it sometimes. So yung quick tip ko po sa inyo, when you eat a certain foods, it's really important na hindi po tayo magmamadali because we can actually feel if may sumasakit sa katawan natin, even sa tiyan. Pag tikim natin, baka masarap siya dahil ito ay very sweet, no? So masarap siya pag nasa bibig, but when it goes down dito sa tiyan po natin, maybe 1 hour later, maybe 2 hours later, we feel na sumasakit yung tiyan after kumakain po tayo. Baka hindi natin ma-realize or hindi tayo aware na meron na palang pamamaga. There's inflammation happening in our tummies. So if I can give you an awareness, if you would listen to your body po, actually the body will tell us a lot of things that we can help ourselves with. I believe kasi po that we have the ability to keep ourselves healthy, to live a long life, and if we want to live a long life and a strong life, we need to go deep into food, kung ano yung mga good foods and bad foods. And there are many of you who have been following me, you know that we all need the water, air, sunshine, exercise, and diet. But right now, we're focusing on just diet. I hope that every one of us is getting enough sunshine, especially for those who are medyo senior na. Kailangan niyo po ng sunshine because it has the vitamin D that gives your bones, helps your bones absorb calcium. And calcium is needed for your bones to grow strong. You need rest also kasi if you're not getting enough sleep, hindi kayo magre-regenerate ng cells niyo po. The repair process sa loob ng katawan natin will not happen. So, if you don't have enough rest, please look into your sleep. Please rest well. Exercise, of course, will keep your muscles strong. When your muscles are strong, generally, the bones are strong also as well. So again, very important sa mga senior po. If you have osteopenia or osteoporosis, exercise is also very important because if you get enough exercise, that means you have strong muscles, and with strong muscles follows your strong bones po. But the joint is a different thing from the muscles po, and I want you to know that if you have questions about osteoporosis, osteoarthritis, message me in the chat below. Let me know if you have any questions because we are going to go into the one thing that is important, yung tinatawag na diet po. Unang-una, what is diet? Diet is what we eat. Long ago, yung diet ng mga tao were fish, meats, and of course, yung mga nakukuha natin sa farm, yung mga gulay, halaman. But right now, there's so many processed foods. And when the foods are processed, ang daming nilalagay na mga chemicals, sugars. And the one thing about sugar na tinatago is the fact na merong asukal or processed sugars yung mga pagkain natin. It is in almost everything. Tinatago nila yung pangalan ng sugar in the form of glucose, fructose, some sort of syrup, and there are 40 different names for sugar that you should be aware of. Again, there are so many different forms of sugar, 40 plus names that you should be aware of. And if you buy something from the supermarket, my quick tip again is to look in the back. If you look at the back, sa mga kinakain natin, you will see in the back, it's usually something that they say how much protein, how much carbohydrates, and the amount of carbohydrates is usually a tell of how much sugar is inside. They don't put anything sa sugar. Sometimes they hide sugar in the names of glucose, fructose, sucrose. Ang daming names, again, 40 different names in which they hide sugar. So if you want to know what's happening in your body, take a look at what you eat. Diet po yung topic natin today, and this is important more than exercise. Personally, this is my opinion. If you are looking to lose weight, we are going to do a challenge again. It will be a 7-day challenge. I'm going to put videos every day for 7 days. If you want to lessen the sugar that you are eating, to lessen the inflammation, to lessen the, to lessen the arthritis pain that you have, this is something that we can do. Meron talagang importance ng food for osteoarthritis. So let's go into the different foods that are good for osteoarthritis. The first thing I'd like to talk to you about is yung mga fish. Fish po, especially yung mga deep sea fish, are very good because these have natural oils that are anti-inflammatory. Pag sabihin anti-inflammatory is nawawala yung pamamaga ng katawan. Those of you who are eating fish oil, that's actually good for the heart because it lessens inflammation. Okay po yan. Omega diet overall para po sa arthritis, then you can definitely think about eating deep sea fish. And of course, we know that weight is important, so wag naman sobrahan yung mga kinakain natin na kahit fish. Everything, of course, everything needs to be po in moderation, ano. So, fish oils, again, may protect your knees from joint damage, from osteoarthritis. Inflammation happens when the body's system reacts to some disease or injury, or sometimes the foods that we encounter. Yung food na kinakain natin can increase the inflammation throughout the body, hindi lang sa tiyan but even the joints. So, eating foods that are pro-inflammatory can worsen, but certain foods like fish, those fish rich in omega-3 fatty acids, omega-3 fatty acids are good for you. Now, ang sinasabi naman ng ibang mga arthritis such as rheumatoid arthritis na walang food for rheumatoid arthritis. Generally, again, this is true, but there are foods na makaka-increase ng inflammation all over our body po. So, if you have rheumatoid or osteoarthritis, lessen the sugar is number 1. Number 2, what are those deep sea fish? No, yung salmon, yung tuna. There are deep sea sardines and mackerel. Pwede po yan. Fish oil is also good, but in general, eating fish is better. Yung totoong isda po. Now, we also want to take about yung mga cholesterol. No? Of course, cholesterol can be bad, but there is a good fat and bad fat po. Hindi lahat ng oils and fats are bad for the body. So that's why we're talking about pro-inflammatory. There's so much misinformation po. Hindi lahat ng fat is bad. Hindi lahat ng fat is bad. So, fats and oils, posible po ma-interchange ko yung dalawa because in science, fats and oils are very similar. So, baka pag sinabi mong fatty acid or fat po ito, and then I say that this is an oil, both of them are very similar, almost the same po. Now, again, don't overeat naman yung mga good fats kasi if you increase the weight ng katawan niyo po, yung pressure naman sa joints po natin is mag-increase po. If we have more weight, that means more pressure sa joints, that will mean more pain po. So, ano pa ba yung ibang foods na may antioxidant and anti-inflammatory effects para mawala yung pamamaga ng buong katawan? There are certain foods like blueberries, strawberries, avocado. They have some what we call resveratrol, and soy products that can lessen again inflammation po. So, again, there are certain foods like yung mga strawberry, blueberry, yung mga avocado, they have these vitamins that can lessen inflammation in your body and in your joints. So in general, lessening the inflammation po sa katawan will of course lessen your pain sa tuhod. Now, another good source of good fats, yung avocados, they are also good in vitamin E. It's an anti-inflammatory again, mawawala yung pamamaga dahan-dahan. I personally like avocado shake for myself kasi it's really good po na good po for the body. Oh, shout out to Ma'am Lorna Kitoy, taga Dumaguete ako. Mama, nakapa-check up orthopedic. Oh, hello. Hello po, Ma'am Lorna, and good morning po sa inyo. Thank you for listening from Dumaguete. I hope to see your mother soon. Sa ngayon, I hope na nakikinig po siya sa mga foods na pwede po niyang kainin sa pag-improve ng joint pain niya. And of course, if she is really in pain, oh my gosh, may fracture. Okay, so aside from being a question and answer po, I also mentioned that this can be also a free consultation. So if Ma'am Lorna, may fracture po yung nanay, tapos yung bones or bukog ay basag-basag, that may mean na hindi siya makalakad if hindi maayos. We will do something for her. Best you message us in the chat para po matulungan po natin yung nanay niyo po, and someone will be with you and hopefully will be with you shortly in the chat po. I'll get back to you soon after po yung live natin po. Okay, again, we are doing a free consultation, group coaching and free consultation online today as a welcome back to myself. So hope you are listening, and Ma'am Lorna, I'll get back to you soon. Thank you for your queries po, no? I do treat patients with fractures kasi po ako ay isang orthopedic dito sa Cebu, and tuloy po natin yung discussion about anong tawag nito, arthritis and foods po. Now, what are the other foods that you can eat po na pwedeng mag-decrease po ng joint pains? No? Yung mga mustard, cabbage, and horseradish, pwede pong magka-lessen po ng inflammation. In general, yung mga gulay kasi very low in sugars. So yung mga hindi matatamis masyado, they are generally good. Fiber is good for the body as well. And I don't think magreklamo yung ibang doktor na sa may patients na may diabetes pag yung mga gulay kinakain walang masyadong sugar po. So, there is of course, no evidence na yung citrus fruits like mga oranges, yung mga matataas yung vitamin C are good in decreasing your inflammation. But right now, a lot of patients would eat these vitamin C rich fruits, yung mga citrus, mga oranges, for immune system po. Yun po, proven naman po yan. So, for vitamin C and yung mga citrus fruits for arthritis, not too much research that I have read personally on that matter po. But you can take this for your immune system. Na other patients are drinking so many different milks for arthritis. Mag-ingat po tayo dyan because not everyone is good in digesting yung tinatawag na milk or lactose po. May mga patients na may lactose intolerance, pwedeng mag-worsen po yung joint pain nyo. If you are lactose intolerant tapos umiinom po kayo dahil nakita nyo po sa website na yung milk na to, yung gatas nito is going to lessen po your inflammation, please be careful. Alam ko maraming mga milk products, supplements na nagsasabi they will decrease inflammation, mawawala yung joint pain nyo. But in reality, hindi kasi pareho yung tiyan natin lahat. There are patients who are lactose intolerant, pag uminom sila ng mga gatas na sinasabing for arthritis, it can worsen their knee pain. So please note po na pag may lactose intolerance, not all the milks are good for you. Kahit sinasabi nila na it's milk for arthritis, please be careful po. And low-fat milk, cheese, they're good in calcium naman. They're good in vitamin D. But for arthritis kasi is the joint. Arthritis is not just about the bone. Kaya magkaiba yung dalawa. Yung bone, good po yung vitamin D and calcium. But for the joints, kung saan yung arthritis and pain, wala masyadong effect yung calcium and vitamin D for the joints. Again, I also mentioned if may injury po kayo sa loob ng joint nyo, it's really important that you get a consultation kasi po, sometimes we mistake yung joint pain natin. Akala natin arthritis when actually you have an injury and the two can coexist together. Ibig sabihin, pwedeng may injury and arthritis at the same time. Pwedeng may injury ka na akala mong arthritis pala and you're trying to avoid all these foods na bad for you. So that can mean na hindi masyadong makakatulong po. So, ano in general yung mga foods na i-avoid for all types of arthritis? We talked about sugar. The next thing that you may need to avoid is lessen your salt intake po. Alam ko pag sinasabing no salt nor sugar, wala naman lasa yung foods natin. So, please lessen lang po yung salt, lessen yung sugar. Bakit pala salt? Salt attracts water. So, it could aggravate yung osteoarthritis and joint pain and swelling kasi. A lot of pre-packaged and processed foods have high salt. Pwedeng mas lalala yung natin, yung joint pain and arthritis po natin. We also have MSG na Betsy, nilalagay sa lahat. Ingat po tayo kasi it can have a sweetening effect and sometimes a salty effect. At the same time, worsening your inflammation po. Now, if you have yung tinatawag na gouty arthritis naman, very specific po yung gout. Kasi yung gout is may problema po yung patient sa loob ng katawan nila na hindi nila ma-digest po ng maayos yung certain foods. So, ano ba yung foods na bawal pag may gout po tayo or yung mataas na uric acid po, Very common yung uric acid arthritis. In general, yung mga anong tawag nito, sardines, anchovies, yung mga scallops, and certain fish like tamban, tawilis, tungsoy, lapad, yung mga yeast and patis. Ingat po tayo pag may gout, it can worsen it. Alcohol can also worsen gout, tsaka mga nuts, certain nuts and chocolates. Peanuts especially. Beans po worsens gout. Pero ano ba yung pwedeng kainin sa gout? In general, fruits, cheese, eggs, cereals are okay. Mga rice products are okay with gout. Butter, bread, pwede naman po. At saka mga gulay. You can eat this if you have gout. There are certain meats na pwede but in moderation lang. Pag nasobrahan, it can worsen it. So I hope that is helpful para sa mga patients natin na may gouty arthritis. May mataas na uric acid po. I'm going to put links naman sa next few posts ko po. And again, I'm inviting everyone to join po yung Facebook group. I will repost a 7-day challenge na para to lessen weight and also improve your relationship with sugar na number 1 na kontra natin pag may arthritis kasi it will worsen po yung pain. Food sensitivities, remember yung mga lactose intolerant, ingat po tayo sa certain milks and supplements na pwedeng mag-worsen ng inflammation kasi hindi lahat ng milks for arthritis pwede po sa inyo. And there are so much misinformation sa market po. I'm going to go into the question and answer portion sa ngayon. If you have any questions, again, we are doing a free consultation online group coaching po. Last question was about a fracture po. Yung nanay ni Ma'am Lorna may fracture po, no? And Lorna is from Dumaguete. In general po, Ma'am Lorna, if you have a patient with a fracture, gusto natin makalakad ulit yung patient. Generally, kailangan ng surgery kasi. So, we will take care of Ma'am Lorna's mother po sa chat na lang po na after this. So, everyone, arthritis warriors, if you are listening, share this with a friend. I am going to go into a question and answer portion. So, please message me below. If meron po tayong mga tanong, basahin natin yung mga questions po sa sa mga arthritis warriors natin. We are going to take a look at the messages. Okay. Ano bang questions na nakasulat dito sa ang tawag nito? Parang naglalag yung internet ko na thanks for following Ma'am Lorna pala. Ga-follow mama nako ni mo, Doc. Okay. So we're going to look into the questions in the chat below. Try to answer some of the questions. Tingnan natin ano yung mga chat po na sinasabi dito. Again, I am at the Cebu Orthopedic Institute Monday to Friday, except Wednesdays po this week. Because Wednesday is either rest day or nag-opera po ako Wednesdays. Last weeks lang, sobrang busy ng Monday and Friday, kaya wala akong So again, we have a question here from, may senior discount po ba yung consultation? Opo, we have a 20% discount on senior consultations. And yes po, that's an interesting question. So we do give senior discounts and there are days na naglilibre po kami. We have a question from Tessie Marty. Good morning po, Ma'am Tessie Marty. Paano, Doc, if meron teared meniscus and arthritis at the same time sa knee? So this is very interesting. I do treat a lot of meniscus and arthritis. Ang question is, paano, Doc, if meron teared meniscus and arthritis at the same time sa knee? Well, the quick answer is that yung pain ng patient will determine kung ano po yung gagawin natin. Kasi pwede kasing walang pain at all pag may arthritis and meniscus, or pwede yung sobra-sobra yung sakit. Sometimes also po, the meniscus pain is on and off. Minsan meron, minsan wala. So in general, pag it's really impacting yung quality of life, yung day-to-day living niyo po, we do what is called a keyhole procedure, yung tinatawag na scope, yung may camera na maliit. Yung camera actually is smaller than a ball pen or a pencil po. It goes inside the knee and we clean up the meniscus if sobra-sobra yung sakit. Pag wala namang pain masyado, sasabihin ng patient, kaya ko naman, Doc, wala namang pain masyado. But in general kasi, meniscus pains are pain when you do bending na todo. If it's really painful, then we do the procedure. If wala namang masyadong pain, we can just observe po. Other options, may mga nag-i-inject ng mga arthritis and meniscus. But be careful pag yung injection ay yung HA kasi hindi yan nakakatulong po. Pag meniscus tear tapos naglagay ng yung lubricant, pwedeng mamamaga even more yung tuhod po. So thank you for that question, Ma'am Tessie. We are done with the diet portion po today. We're doing a question and answer and a free consultation online po sa mga arthritis warriors natin. May nagtanong, where are you located? Again, I'm at Cebu Orthopedic Institute. That's 4th floor, Robinson Cybergate in Cebu City, room 401 po. I'm here Monday to Friday, except Wednesdays, 10 a.m. to 3 p.m. Again, that's Monday to Friday, except Wednesdays, 10 a.m. to 3 p.m. Salamat po sa tanong. And we are going to look into the next question sa chat po. Let's take a look at the chat. And you're very welcome, Ma'am Tessie. Thanks for following po. So, going to look at the next question from the chat. Medyo mabagal yung internet ko, so Thanks for bearing with me, mga arthritis warriors. Again, I'm going to try to get back to all of your questions within the next 15 to 20 minutes. Tingnan natin kung lalabay. So, nandito si Miss Daisy. Good day, Doc Joff. Is trigger thumb a type of arthritis? I had it, but now it's fine. So, Miss Daisy, salamat po sa tanong. Yung trigger thumb is actually a form of tendon na naipit. So, it's not arthritis, but may tendon na naiipit. Pag nawala yung ipit ng tendon niyo po, di mawawala. Then you will be fine naman po. So, thanks for that question. And hello po, si AJ. AJ, good morning. This is Dr. Joff. Hope to answer your questions. So, again, may nagtatanong sa clinic, Cebu Orthopedic Institute, 4th floor, Robinson Cybergate po. Ang sabi dito ni Ma'am Gabriela, good morning, Doc. My mother is suffering sa sakit sa lukon-lukon. Para sa mga nakakaintindi, lukon-lukon is the back of the knee. Pag may pain sa back of the knee, we really need to examine it properly. Most likely, may mga meniscus na injury. Sometimes may konting arthritis as well. So, we look and we treat this at the same time po. So, really need to check and examine the patient. We actually examine them on the bed dito sa likod ko. I have the patients lie down. I examine their knees po. At tapos, doon ko malalaman kung ano yung actual cause. Even before you get your MRI, meron akong idea kung ano yung meron po yung pasyente po. Again, Ma'am Tessie is asking about collagen injection sa namamaga na knee. In general po, pag namamaga yung tuhod, yung mga injections, in general, except yung mga steroids, worsen the pain, worsen the inflammation. So, gusto natin malaman kung ano yung cause ng pamamaga because if it is an injury in the knee, you don't want to inject anything pag may injury yung tuhod kasi it will worsen the pain and the swelling. So, in general, if it's an injury or arthritis, we really examine the patient here on the bed para malaman ko po kung ano yung problema. Of course, if you have your x-rays or MRIs, that could also be helpful sa group consultation natin po. Now, let's go to the next question from Ma'am Shami Tan. My mother had knee pain 3 to 4 months. Maglisod siya lakaw. What's the best medicine for her, Doc? So, if your mother has arthritis, Ma'am Shami, then we do start the patients on certain supplements like glucosamine, and we also give maintenance pain relievers, and I typically give something that is safe for the gut, safe sa chan, safe din sa kidneys, and I maintain them on 1 month. You can actually get this in any drugstore. It is plain paracetamol. It can be any brand, and you take it every day. You ask, of course, your doctor if you are okay to take paracetamol because it's always best to consult your doctor. I hope that helps. Let's go to the next question po, no? We're running out of time. We have about 10 to 15 minutes po sa group consultation po natin. And we are answering questions on diet, arthritis, or even knee or injuries na sa bone po. This is Dr. Joff. If any arthritis po yung specialty ko, and you can find me here at the Cebu Orthopedic Institute. That's room 401, Monday to Friday, except Wednesdays. That's 10 to 3 p.m. po. So, maraming nagtatanong about how can I contact you po, Doc? Para sa mga patients na gusto mag-contact sa akin, I will give you the the number ng secretary ko po. Minsan kasi the phone is not working, it's really busy. So you can contact Ma'am Joy, our secretary, 0995, that's 0995 537 978. That's Ma'am Joy. We have our secretary, that's Ma'am Joy. We also have a landline 0917-239-2211. That's our landline for today. So going back to the other questions para sa group consultations. Good morning. Duna ko arthritis pero wala medication from the doctor. Advice niya mag-lose weight po ako. So, if you have arthritis, number one is, of course, changing your diet, because yung pinag-usapan natin today is the diet is very important. Certain foods can worsen your arthritis. Losing weight, also very important po. This is Ma'am Miraflor. Losing weight is very important because the more weight you have, the more pressure naman sa joints. But I have told you that I give my patients maintenance medicine for the pain, that's paracetamol, and glucosamines as supplements. Yung tinatawag na glucosamine, maraming types. Of course, there is glucosamine that you can buy anywhere. Generally, it is less effective than the glucosamine you can get from the pharmacy po. Yung mga pharmacy, they have a higher grade of glucosamine sulfate. That's the supplement that we can give. I also am a speaker for yung probiotic that is good for osteoarthritis. It is relatively new. Probiflex po yung pangalan. And it is good bacteria. Parang Yakult, good bacteria para sa tiyan. Ito naman, good bacteria para sa joints. So, thanks so much, Ma'am Miraflor. That is my advice. AJ, akong hip doc kay na-dislocate na siya arthritis sa bukog. So, salamat sa pangutana, or thank you for your question, AJ. Yes, if you dislocated your hip joint and you have arthritis, it means na matagal na po na dislocate. It can damage the joint kasi. In these cases, kailangan natin makita talaga yung x-ray nyo po para makita natin kung ano yung best advice for your dislocated hip na may arthritis na. In general, yung arthritis, we do procedures like replacements for severe arthritis na po. And we really need to see and examine this patient. Again, pinapahiga ko sa bed, ina-examine ko if nagagalaw pa ba nila yung joint nila o hindi. Because that can help us a lot, no? I hope this answers your question, Sir AJ. We need to examine that. In general, arthritis na severe may need a replacement surgery. We do help patients with either private or charity surgeries. We help them get their charity surgeries pag hindi nila kaya po yung mga private surgeries ng joint replacement. Minsan kasi it can be very expensive. And we have another group para sa may mga bata na may AVN type of arthritis. Message me if you are a patient with avascular necrosis or AVN. If you have that, we can lead you to the group. They are very helpful naman. Yung grupo na gustong magpa-joint replacement, nagtutulungan po kami on how we can get these surgeries done kasi mahal po yung mga implants. Even help them go to government offices. Paano po maka-discount? Paano po makatulong yung PCSO, DSWD po? So AJ, yeah, we can message you. If you have insurance, I can definitely examine you. I'll be here Monday to Friday, again, except Wednesday. We'll take a look if your arthritis really needs surgery or not. Para natin magawa yan, we need to get your x-rays. We will need to examine you po. Yun po yung best advice ko po. It's really examining the patient properly, examining the x-rays, also taking a look at how bad the pain is for you po. Hindi lahat ng may arthritis may pain. Hindi lahat ng arthritis na may pain kailangan ng surgery. So it really depends on how you feel. So I hope that helps. We have 10 more minutes, 5 to 10 minutes left. I will get to the next question po. So the next question is from, sino to? Again, clinic hours and location po. Cebu Orthopedic Institute, look for Dr. Jonathan or Dr. Joff. I am here Monday to Friday, 10 a.m. to 3 p.m. except Wednesdays. Wala akong Wednesday po na clinic. And then, Gladys has a question. I know, can I heal my pain if I drink more herbal? Daghan salamat. So, can I heal my pain if I drink more herbal supplements? In general po, we need to know ano yung cause ng pain. Is it an injury? Is it arthritis? At saka number 3, ano po yung herbal po na tinitake nyo po? So, if hindi natin alam kung injury or arthritis, hindi kasi natin matitreat ng maayos po, Ma'am Gladys. At saka kung may herbal po kayong iniinom, mag-ingat lang po kayo kasi not all herbals heal, not all herbals are good for you. Again, maraming nafu-fool ng mga herbal medications kasi they want to hope na ito po yung cure. And every time a patient buys another product na nakikita nila may testimonial kasi may patient na nakita silang gumaling. Again, it's really good advertising. I don't want to take away your hope po. Pero I do want you to be careful sa mga binibili niyo kasi ang marketing strategy nila ay nagbibigay po ng mga pasyente na may testimonial na, uy, gumaling ako. Take niyo po ito kasi gumaling po ako sa herbal na to. Tapos, pag hindi gumana, titingin naman sila ng ibang advertisement, ng ibang herbal, try na naman nila. So, mauubos po yung pera ng mga pasyente sa mga hindi gumagana. So, be careful, Ma'am Gladys. Again, yung tanong ni Ma'am Gladys is, can my pain be healed if I drink more herbal? Hindi kasi natin alam kung ano yung pain ni Ma'am Gladys, if it's arthritis, if it is an injury, and hindi din natin alam kung anong herbal na hindi kasi nilagay ni Ma'am Gladys dito sa chat. So thanks, Ma'am Gladys. Hope that was helpful. And next question po natin is here sa chat. This is anong tawag nito? Si Sir AJ, yes, thank you sa information. Muhanha ragid ko. Yeah, feel free to set an appointment. I will give my my link naman dito sa chat. And I do accept insurances para sa mga nagtanong. Almost all insurances ina-accept ko po. So, ano pa ba si Ma'am Elena is asking how much is a consultation. For seniors po who have 20% discount, the consultation is about 600. Pag walang senior, it's about 770 po yung yung consultation fee ko po. And then there are days na nagbibigay ng free consultations face-to-face. That was before Christmas and also earlier this year yung celebration natin na after yung 1 year after yung bagyo. So be on the lookout if you want to get a free consultation kasi wala kayong pambayad. I really want to help patients pero hindi naman pwede libre lahat So hope you can find the free consultations. I think we have time for one last question. So if you have mga questions or comments, you can chat it below and we can get back to you as soon as we can. If you have no questions, I am going to end this video. Salamat sa lahat ng mga arthritis warriors who have been listening. And I hope to do this live weekly. Pag hindi ako masyadong busy, I'm going to try to do it on the weekend. So, much love and respect. This is Dr. Joff. I'll see you soon. Bye-bye. I'm back in Cebu. Hope to see you.